from you, what is lupus? How anyone would know that that person is suffering from lupus? What are the basic
Yeah,
symptoms?
yeah. The thing is, no one knows what is lupus. Even the doctors don't know. Society doesn't know. Patients don't know. Relatives don't know. Friends don't know. Nobody knows what is lupus. And even when it starts, nobody knows. Okay.
Yeah.
So you have to be just lucky to go to a doctor who can think about it, do the test and refer to rheumatologist. Okay. For that only thing is self-education and awareness is required because this is not a common disease. So everybody knows about cold. Okay. If you sneeze, cough, what will you think? You have some allergic rash. If your hair is falling, what will you think? You say you are not taking good food. If you are having fever, you will say it is malaria. If you have joint pains, they will say, okay, I think you are WhatsApping too much and you are just training too much. You are not taking enough rest or you are working too much or you are not eating good food. If you are losing weight, again problem. So if you have a seizure, they say, oh, something mata aa gaya or something. So if you have extensive rash, they say mata aa gaya. So nobody is able to link it to lupus because it's very, very wild thing. It can affect everything because if you know in the cell there are three things: nucleus, cytoplasm, and the cell membrane. Okay, just like in a cell phone, you have the display. Inside all these ICs and inside everything is there circuits, and there is a cover. You have a lupus. Mobile cover a display and the inside machine. Okay. So in the cell there is nucleus, cytoplasm and membrane. In lupus there is autoantibody against everything. So you have autoantibody against all components of the cell. So which autoantibody is prominent, you will have that. So there is antibody against most of the antigens. So everything can be affected because all the components can be affected.
All right. Sir, what are the basic tests which 100% confirms that somebody has got lupus?
By IFA. ANA by IFA.
By IFA. So, sir, you are saying that only one test, which is ANA by IFA, is the test which can confirm that somebody has got lupus, and that's a 100% with 100% surety. So, what are the basic symptoms which all the lupus patients do have? There are various types of illness problems that lupus patients are facing, but what are the common symptoms that we should look for?
But before I tell about common symptoms, whatever is written in Wikipedia, in our textbooks, whatever is told in the media, slides, friends, doctors is different. Because what has happened is because of better diagnostics, patient don't get the full-blown lupus. Okay, we are able to detect it so well if they go through the path. It's just like how early you go into the path.
Okay. So lupus does pass on to progeny?
Yes and no. We do have people who are familial, mother, grandmother, aunt and all. So, but most of them it is out of the blue. So what happens, the mother has got a lupus-like gene, but there are other genes which are protective. Due to unknown reason, this protection goes off so that the lady gets lupus. Some components are there. Some components are stress, infection, drugs, worries, other autoimmune diseases, genetic, some infection. So multiple reasons.
All right. Is it something like that women are more prone to lupus and men are less?
80% lupus are ladies, 20% are men. But in the 20%, it is very angry. Okay. It's a bad lupus if it gets in male. It's a mild lupus if it gets in female.
So why is it so? Why women are more prone to it? Is there any reason behind it?
Yeah, estrogens. Estrogens are the thing which kick childbearing age, when you're becoming pubertal age, when you're in the 30s, 40s, 20s, 50s, when your hormone is active, the lupus will come. 10-year girl less, very less lupus will come. 60 years के बाद बहुत कम लोग को lupus नया शुरू होता है.
Okay, sir. So, what are the precautions that we should take while somebody has lupus, or one should not have lupus? Should
You can't prevent it. Yeah, you can't prevent it. If it comes, it has to come. If it doesn't come, it doesn't come. There's no way that doctors cause it, or some illness cause it, or some medicines cause it, or something cause it. But once you are diagnosed, yeah, you are selling something. I forgot.
Can lupus patient live a normal life? Like they
Normal life.
have normal life.
Previously they used to die 5 years after diagnosis. आपको अगर किसी को 30 years में डायग्नोस हुआ, 35 तक कोई इलाज करने से they will die. Okay, about 50 years ago.
All right.
Now they live more than normal life. Let us say average age is 65. They live beyond 65 because they look after themselves. The rheumatologist looks after themselves, and certain medications are protective, and that's the reason they stay home little more, so they protect themselves. So they lifespan is more, and even if they have some major illness.
Yes. So, is there any categories of lupus, like lupus nephritis?
Yeah. You have mild lupus and not so mild lupus. I won't even say it's a bad lupus or a severe lupus. Just say mild and not so mild lupus. Okay. Only two categories. Mild lupus means some skin rash, some hair loss, some DLE, some joint pains, and it goes off. Major lupus means it's coming into major organs. If any one of your organ is involved, whether it is ear, whether it's a nose, whether it's your eyes, whether it's a heart, whether it's your lungs, whether it's your gut, whether it's your neurology, whether it's limbs, it's a major organ. Simple.
Okay, so what about the medicines? Are some common medicines which all lupus patients are taking, or they have to take common medicines?
Yeah, there's only one medicine that is hydroxychloroquine.
All right, so without
that is the medicines for lupus. Yeah.
Sir, so most of the patients are put on steroids, immunosuppressive drugs. So why is it so that they have to put on these kind of medicines, immunosuppressive drugs?
Again, I will give you an example. In lupus, what happens is there is no problem with the body. There is no problem from outside. It just can generally suppress the immunity. This is hyperimmunity. So it poison कर देता है. They are not immunosuppressive. They are immunomodulator. Steroid is an immunomodulator. HCQS is an immunomodulator. Mycophenolate is an immunomodulator. Azathioprine is a modulator. You have cyclophosphamide, which is very strong. That is an immunosuppressive.
So does these medicines have side effects?
Actually, no, nowadays, because we have learned how to avoid the side effect. They may if you don't monitor. Let us say I am given 20 milligram of prednisone, and the doctor says you come after 1 month, and you don't go for 1 year. Due to some reason, social reason or some other reason, so then you will get sick.
Okay. So, is there any success story where lupus patient is completely cured? That person needs.
Yeah, many are there. ANA has become negative. They have become all right. They are not on any medicines. They are transformed. That also happens. Normally ANA negative होता नहीं है, but बहुत सारे मेरे से हो गया है because of not me, because of two things. One is HCQS, and because the patient has been brave to follow my medicines. That's all. They become negative.
Okay. So when it is negative, they need not to take HCQ, or they have to continue taking HCQ?
Acha, there are two things about it. If they are going to be with me in close proximity and they are going to be followed and they express a desire to stop execution, we can stop it. But if I am sure that they are going to go away from me, yeah, they go for Ayurvedic, Siddha, they're not the ideal patients, then I put them forever execution so that they should not get a flare. But if some empowered patient is there, doctor, I feel all right. I need you to stop the execution, but however, in case required, I come back to you and restart. That I have done, and people are off execution for 10, 15 years also.
Okay, all right. So it can recur. You mean if ANA is negative, sometimes it happens after some years that
Yeah, yeah, it can recur after 20 years also.
Patients do talk about themselves but never talk about the doctors, because doctors are also going through a lot of mental trauma while they are treating patients. So what is your experience? How do you deal with your mental trauma when you see some severe cases and all?
Okay. Uh, Actually, I feel bad for something else. Okay, because doctors can give only medicines. Cure is done by the family, patient, God, everybody else. Okay.
Yeah.
So we can do only that much. So it pains me that the society, so the relatives and the family members, they don't care that much, and the patients sometimes again don't follow the doctor's advice. So they suffer more. Like if they don't come for review, they suffer a lot. Okay, so I don't want the patients to suffer. The suffering while on treatment is really painful. Let us say I write for a renal biopsy. Let us say there's a kidney involvement. So
Yeah.
they will say, is it okay, doctor? I should not take. I'm very scared. So a doctor will say, nee, nee, okay, don't take. Don't do the biopsy. There may be some complication. If you are really scared, don't take it. But then it gives an adverse outcome. So previously, doctor used to force the ladies or patient.
Okay.
No, 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 नहीं आएगा तो मैं देखूंगा नहीं. Because at the time ignorance level were high. Now patients are empowered. If I talk not okay, they'll go to some other doctor or they'll go to the local doctor and all. So if I want to retain the patients, I have to listen to the patients at all, because ultimately it's the patient who is not having the illness. It's the patient who is suffering. That is my concept. So we have to go towards the patient and then take a call from that. And of course, we suffer with our patients suffer. Whether it is a mental thing, physical thing, career going, or dawai nahi mil raha hai, neglected patients, if there's a permanent issue, everything we suffer. Actually, we always think we could have prevented it. We could have prevented it. A lot of young girls have been given so many steroids that they got avascular necrosis and they are not having affordable money to change the hip joint. So their entire career is gone. You know? The career path has to turn. So it may be acceptable after maturity, but it may not be acceptable for a young girl of 16 years who has got something to do. Let us say she wants to become a journalist, she has to run around. Now, because of this hip fracture, she is not able to hip with avascular necrosis. Every step is painful. So the next step is a joint replacement. So they don't get support, neither are we able to give a support monetarily and some other way so that she can get operated.
I'm a lupus patient. Precisely, I would say I want to be and I'm willing to be an ex-lupus patient. So I always try myself in my best to be in remission. So in last 2 years, I've been in remission and I'm really happy about it. My story, to cut long story short, I was diagnosed 6 years back. Being in a corporate culture and being under excess stress, which I think has been the biggest reason for me to have my autoimmune disorder. I was diagnosed and I had a pulmonary issue. So now, after taking 2 or 3 rounds of steroids and being not going outdoors, taking things in control, I'm better, a lot better now. But quite, I think, few questions always ponder. For example, how safe it is for a woman, since generally it happens to females, how safe it is for them to conceive, since I am still a 41-year-old lady now, but for young generation, I think they really want to contemplate, and there are many people who ask about it.
Oh, okay, what are you working as?
I was working in sales with the financial sector from financial and insurance background. Now I am not working. I took a sabbatical and I am now at home.
Oh, and how many kids you have?
I have one daughter. She is 12.
Okay, cool. So what is your actual question is that when do you conceive? You should conceive
Youngster.
whenever you want to conceive. Simple.
Okay. Are there any
It is the
complications
duty
that
of
happen?
doctors to just tell you how to fail it. Of course, if you have very severe renal involvement or a brain involvement, you can wait for about 3 months. Though they say 6 months remission is required, I don't believe in that personally. I believe in the both the husband and wife are willing to get conceived. You can get conceived. There can only be two issues. Okay, there can be only two issues for a lupus pregnancy. One is because of antiphospholipid syndrome. They can have thrombosis, which can affect the mother or the child. So it's a precious pregnancy. And number two, if you have one subset called RO, the child can come with congenital heart blocks. So which is not an okay thing. The child will have to be put on pacemaker. So it is easier said than done because it's not diagnosed and it's a pain because the child is otherwise normal. So we cannot see, somehow it depends on doctor to doctor. I said somehow I always encourage to have pregnancy, encourage to have the children. Even if the child is having congenital block, you say that you finish the term and then let us put a pacemaker, let us try ahead. All things I've done. So I don't go against the grain. I don't ask for a termination of pregnancy unless, of course, the gynecologist asks if the mother is not well due to PIH or BP or kidney problem or something. Otherwise, if we plan parenthood, it has always been smooth to me because of the effort involved by the couple to listen to me. I have no effort to do because I have to just give marshal. But the implementation has to be done by the couple and the gynecologist. Many times there is a discordant mode between the gynecologist and the rheumatologist. It's okay because their subject I won't know, my subject they will not know. Unless he is a lupologist interested in pregnancy, obstetric lady care, or an obstetrician interested or with experience of lupus pregnancy, which is not common at all. So that is the reason.
Okay.
Sir,
Another
there
question would be how different is taking immunosuppressants and biologics or maybe chemotherapy. There are people who keep questioning this that uh, is it a good idea to take chemo and maybe kill the entire thing and then start a new dose of life. So is there any way
Yeah,
that
there
science
are
is
two.
thinking
There are
about
two
it?
aspects of it. Okay, most of the drugs are only immunomodulator. They are not immunosuppressive at all. For lupus, like a mycophenolate, prednisolone, azathioprine, methotrexate, so many drugs are only immunomodulator. They are mild. Okay. But sometimes when your kidney gets off or if there is a CNS involvement, you have to give what is called as a cyclophosphamide. The only problem used to be with cyclophosphamide is that it will reduce the fertility of the lady. Okay, but actually it doesn't. That's a problem or it's a good thing. It doesn't actually reduce the fertility. It depends on so many factors. If you give too much of immunosuppressant, then it definitely reduces the fertility. But there are ways to circumvent it. One is that you give a urolupus regimen. You give for short duration. You give with lot of precaution. You give with mesna and you substitute for cyclophosphamide with mycophenolate. and we give a pregnancy safe drug like azathioprine, which is absolutely pregnancy safe. Hydroxychloroquine, steroid. There are a lot of good drugs which can be given through and through in pregnancy. And the cyclophosphamide, what people do is actually they found those even many people have become pregnant. Let us say you give cyclophosphamide at 16 years or 17 years of age, then the ability of the lady to ping back, it is actually with vengeance. Like it will come back absolutely normal. But as a generalized statement, we say that नहीं fertility को affect करेगा. You sign them. It's all how you tell actually. So if you tell in a minor manner, nobody will reduce. Then you should say that whether your organ has to be preserved, and many have delivered after cyclophosphamide. They've got 3, 4 kids and they're doing well. But let us say a 40-year-old old lady who have got few eggs in her, then she wants to get pregnant, and we have to give cyclophosphamide. There is a way out. You have to preserve the eggs. Now we can preserve the eggs. In cryo preserve the eggs, give the cyclophosphamide, and after some time you can re-implant the eggs and then use that eggs for the production of baby. So there is no problem.
Sir, there is a question from Soma. The last question is, there is always a link between lupus and mental health. So, how to deal with our mental stressors when somebody has lupus?
The thing is, lupus in itself affects the mind, okay? It causes a lot of fatigue. In fact, the one symptom of lupus which I cannot treat or address or confront is fatigue. So much so that patients don't, they are even fatigued to tell the doctor that they are fatigued. Tiredness, sapped energy, okay, not able to do, mental fog. See, if there is arthritis, I can cure. If there is a kidney disease, I can cure. If there is a seizure, I can cure. If there is a heart problem, I can cure. Anything in the lupus, I can do something. But what do I do for fatigue? I don't know. Because of this extreme fatigue, mental fog, and because it's a major illness, okay, affecting every cell, not because of the illness people are depressed. Means इनसे बड़ा बीमारी हो गया इसीलिए उदासी हो गया नहीं it is built in. Lupus have got a lot of mental changes because there are some antibodies which crosses to the brain and affect your brain. So basically for that you should take a little bit of steroids, 5 milligram of steroids, little bit. And if you are really feeling sad, depressed, you don't suffer. Please don't suffer. Take a mild antidepressant. It's not a crime to take antidepressant. But to stabilize it, we can do two things. You can take steroids in the morning, HCQS again in the evening, and little bit of tryptophan or Nexito or something, so that you should have a good sleep actually. If you are disturbed, you will not have a good sleep, you will not have a good food and all. After about 6 weeks of therapy, once you are feeling okay, disease has gone into remission, then you can go for hula hoop, whatever you want. You can go for running, you can go for gymming, you can go for weightlifting, you can go for paragliding, you can go for singing, whatever. But you have to come out of the loops. So step one is you have to realize that 2, 3. 1, 2, 3 is one roof, 2 sets of clothes, and 3 hot or non-hot meals per day, or 3 some calories per day. Many people are not.
Roti kapda makan.
Yeah, 1, 2, 3. One roof, 2 sets. 1 set से तो नहीं चलेगा, and 3 meals तो खाना ही पड़ेगा. 2 meals से थोड़ा जाती है. So if you remember 1, 2, 3 when you get up, do you have 1, 2, 3 today to pull you down, means to carry you through the day, not pull you down, to carry you through the day? I think that's a victory. Every day you are victorious. Just like somebody's got lupus, they'll say, why me? So it's one way of looking at it. You just take it along with you. I always say some lupus patients cannot accept. Why should I get? Why that person will not get? Why should I get? So you said, okay, now that you have got, you cannot change it, but you take that lupus as your shadow or your twin sister, and then take it along with you. God has given you to take it in your side pocket. So side pocket में कहीं रख देना, but don't think about it. It's there in your.
Thank you for joining us today.